Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hi, everyone. It's Nurse Paula Young. Thanks so much for joining me again this week on It's a Young Thing. And this week, we're going to be talking about something that I touched upon in episode 16, Tell Me About Male Aesthetics. And it's called Gynecomastia. And gynecomastia is swelling of the breast tissue, and boys kind of going through puberty, and also men, and it can affect either one or both breasts, sometimes even, unevenly. And a lot of people don't understand. I think people kind of overlook this whole issue of why men have breasts in the first place. I mean, a lot of people don't realize, there's a reason why men have nipples. They don't nurse children. And there's a reason why men have breasts. And the very first several weeks that an embryo develops in the womb, it's following a female blueprint. So basically, all fertilized embryos start out as a female. And it's really only until about after 60 days of development that the testosterone starts kicking in. And that's what changes the genetic activity of the cells in the genitals and in the brain. But by the time that happens, actually, the breast tissue and the nipples are already formed on the embryo. So, there's no stopping that. It's there, it's formed. The nerves are there, there's blood vessels in there. Everything is already formed for breasts. And that's why men have breasts and why men have nipples. Now, on other mammals, this kind of doesn't happen that early of a stage as it does for humans. So that's why a lot of male mammals do not have nipple formation, because it's kind of stunted by the hormones, but not so much in humans. So because men have the same type of breast tissue that women have, and we have the fat that's there, we've got the nerves that's there, and we've got the blood vessels that's there, they can have similar problems that women have. So now gynecomastia, it's just the medical terminology for male breasts. And it can be triggered by hormonal changes, a decrease in the testosterone with maybe an increase in the estrogen, or maybe just even an imbalance between the testosterone and the estrogen. And there's a lot of things that can cause that to happen. Also, it can be caused by maybe a condition that's blocking the effects of testosterone, or just anything that increases the estrogen level in a man. Typically, this is happening in adolescence with boys and during puberty, where these hormones just start going up and down and up and down, up and down. There's really no balance in there. There are some medications that can actually cause breast swelling in boys and men. And some of them are everybody knows about steroids, anabolic steroids that weightlifters take and bodybuilders take. That's definitely one thing that can do it. Also, some anti-androgens that's used to treat prostate cancer and prostate enlargement. Also, some other medical conditions that's used for. Certain AIDS medications, some anti-anxiety medications, some antidepressants like Valium even, some antibiotics, some ulcer medications, some chemotherapy drugs, some heart medications like digoxin. It's a very common heart medication, some beta blockers, some calcium channel blockers. A lot of these things can actually cause breast swelling in men. Some substances that can cause gynecomastia: alcohol consumption, amphetamines, marijuana, heroin, methadone. Some of these street drugs can lead to breast swelling in men as well. Now, also, there are some health conditions that can cause breast swelling in men, and it would be hypogonadism, aging, some tumors, specifically maybe around some of the glands like the adrenal glands and such, that have to do with hormone levels in your body, or the testes, and maybe even the pituitary gland hormones or tumors around the pituitary gland, hyperthyroidism, kidney failure, liver cirrhosis, malnutrition. So this is why, if you have breast swelling, if you're a man and you're listening to this and you have swollen breasts or if you have enlarged breasts, this is why it's best to really get it checked out by your doctor to make sure that there's no underlying condition that needs to be treated first, or perhaps maybe one of the medications that you're taking for your heart condition or liver condition or something like that is not causing this condition to occur, because maybe all it would take would be a change in your medication, and then that could bring down the swelling in your breast. So we don't just like jump on treating gynecomastia. We always try to see what the underlying cause is first. That's prudent medical advice, is always to find out what the catalyst is for this or what the cause of this is. Now, there are some conditions that can cause similar symptoms. Fatty breast tissue. Some men and boys just have a lot of chest fat. They've got kind of fat everywhere, and it just resembles gynecomastia, but it's not really gynecomastia. And we call that false gynecomastia or pseudo gynecomastia. And it's just not the same as standard, gynecomastia. Breast cancer. Yes, men can get breast cancer. I know it's not as common as women getting breast cancer, but men are susceptible to breast cancer and can get breast cancer. So another reason why you really need to get to your doctor if you have a swollen breast and to get that checked out. Perhaps a biopsy may even need to be done if they suspect that it may be malignant or a precancerous tumor. Another thing is mastitis. Now, mastitis is the medical word for an abscess, like a breast abscess. And that's really just infection of the breast tissue. Lots of times, some antibiotic treatments or maybe even aspirating the abscess is the treatment of choice for mastitis. Now, most cases of gynecomastia can regress over time if given enough time. But if it's caused by an underlying condition like hypogonadism or malnutrition or cirrhosis, then that condition needs to be treated. And we already went over about, medications and things like that. You may need to have some med changes. Now, in adolescence, with really no apparent cause for gynecomastia, we just recommend just reevaluations every 3 to 6 months. And usually it kind of resolves itself on its own over time. I mean, often it goes away without treatment within 2 years. However, someone may need a treatment if it really doesn't improve on its own, or if it's causing like significant pain or tenderness, or the swelling just kind of seems to be getting worse. Now, treatment. There's a couple things you can do for treatment. So if everything else is kind of ruled out and it's not caused by medication, it's not caused by an underlying medical condition or a tumor or anything like that, then there are some treatments that can be done. Now, like I said, back and we talked about that episode of Tell Me About Male Aesthetics, male breast reduction, gynecomastia reduction, is probably one of the most popular surgical procedures that men are having done. And this is, proved by statistics, and it keeps increasing every year and every year and every year, higher and higher. So first thing that you have to do is when you go into an aesthetic provider, I know if you come into Young Medical Spa and you're being assessed for gynecomastia, the first thing we have to really determine whether or not it's fat or a gland. We have to differentiate the fact that it's a fat from gland. And, young men that are really big into steroid use, like I said before, your weightlifters or your bodybuilders and things like that, they usually have a really hard gland under there, and you can feel it. It's really hard and it's solid, and that has to be removed surgically. There's no way you're going to be able to get that out of there other than having it excised out of the breast tissue. Most cases of gynecomastia, a liposuction technique works really well. Now, especially when you get older, because the amount of fat that we get as we get older, it's one of these, I always laugh with my producer about these funny things that happen to us when we age. Well, we tend to get fat in places that we never had before, and that's due to our hormonal changes as we age. So it's kind of like a double whammy there, aging and hormonal changes that go along with it. So because we have more fat as we get older, really a liposuction procedure would work best for that type of breast tissue. And If you remember in episode 20, we talked about, tell me about smart lipo, and we talked with Dr. Young about smart lipo and gynecomastia as one of the things that he mentioned. It's probably one of the number one procedures that we do on men in our office at Young Medical Spa. And it's very simple and very easy. So if any of you are really contemplating having a smart lipo procedure performed for male breast reduction, I would, direct you back to episode 20 so you can listen all about what smart lipo is about, because there's some really important pearls in that episode that you really should listen to prior to undergoing that type of procedure. But it works very well. I mean, some doctors' offices just use your standard liposuction. At our office, we tend to like to use the smart lipo, which is the awake tumescent liposuction, laser liposuction, because it goes in with the laser. It literally melts the fat, and then we can suction that out with a very small cannula, and all of it's done through a small hole, usually done through the nipple so that there's no scar or any mark after the procedure's done. And with all types of procedures like that, there will be a compression garment that you would have to wear on your chest, but that goes under your clothes and nobody would ever know yet. It's like a band that pretty much just goes around your chest to compress the area for time as the tissue heals after you've had the smart lipo procedure done. And nobody would ever know you had that on. You could easily go to work and nobody would ever know you had that done. Downtime is extremely minimal and there's very little risks, and it's a very quick and easy procedure, and recovery time is, just days, really, just days. You might be a little tender if you punch in your chest, but it's just really days. And you could resume your normal physical workout and your activities after that. So it's really not that big of a deal. Now, you also can do a non-invasive approach to reducing the fat on your breasts, and that would be done with Coolsculpting, something like Coolsculpting, and that would be freezing the fat. And then again, I'm going to direct you back to an episode that we recorded, Tell Me About Coolsculpting, and that's completely non-invasive. It's a great way to reduce the fat in the breast tissue, but it's not, I guess I would say the results take a little longer because you're not going into the body to melt that fat and get it out like Smart Lipo does. You have to give the body time to get rid of all that fat that was just released out of those cells that you just froze. And so that usually takes up to, I'd say, 1 to 3 months until you really then see the results of that. But with that, there'd be no compression garments or anything like that, or any leakage or drainage from the fluid coming up. But that's up to you. That's what's great about aesthetic medicine is there's choices. There's non-invasive ways, there's minimally invasive ways, there's a little bit of downtime, there's no downtime, there's quick results, and then there are slower results. And that's one of the beautiful things about going to a medical spa like ours, where we have a variety of options to get you to the clinical endpoint that you want to be at. So when you're seeking out a practice, wherever you may be listening to me from, wherever corner of the world you're listening to this episode, is that, you really do want to seek out a practice that has a variety of options that not only fit your goals and your desire, but also your downtime and your wallet. Because there's a huge difference in price lots of times between a minimally invasive and a non-invasive procedure. So it really does depend. And these procedures are not covered by insurance. So it's something that you really have to weigh all the different options, and you get your best results at a practice that has a variety of things that they can offer you. So, there's varying degrees of breast reduction in men. The mild ones kind of just want to look more toned and get their pec muscles, showing better. And the moderate to severe ones are getting it done because it just does not look pleasant when they take their shirt off. They may feel embarrassed and they want to do something about it. So, breast reduction surgery in men, or breast reduction procedures in men, is very convenient because you can literally return to work within, a day to a few days, and with very minimal pain or discomfort. So that is everything that I wanted to talk to you about gynecomastia, male breast reduction in men. There's more and more procedures coming out for men that are getting more and more popular. The stigma's being released on these things. Men are, wanting to take their shirts off and be hairless and be toned and be ripped. And these are the little things and tweaks and tricks that you can do to try to get, your body back into shape. I want to mention that even some of the best gym rats that I've seen come in, and these guys are really built and they're really muscular and they're really strong, still have male breasts, and they don't understand that. So they work on their pecs harder and harder and harder, and it does nothing. And they just don't understand why the male breasts are still there, why the breasts are still there. And it's like, because it's hormonal. Building up your pec muscles is just going to make your pec muscles bigger, and it's just going to push the breasts out a little bit further. And you're still going to have that mound of fat that's on around the nipple area. So no matter what you do in the gym, it's really difficult to get rid of these hormonal pockets. The breasts are one, and another one is the love handles. And those are just areas that in belly pooches, those three areas are things on men that have to do more with hormones than pretty much anything else. So even if, like I said, even if you're in the best of shape and you have male breast tissue, you might want to seek out a provider that provides gynecomastia procedures. So that's everything this week on male breast reduction. I appreciate everyone coming back and joining with me, talking about these different procedures that we do at Young Medical Spa. And make sure that you share this with somebody that that might be suffering from this condition or embarrassed of this condition, because a lot of guys don't want to come in and talk about this. It's hard for them to come in and sit down and talk about this. So perhaps if they listen to this, it may just make them be a little bit more educated, a little bit more comfortable to go in and actually make a consultation with a practice to learn about more or what their options may be. Thanks again, and we'll talk to you all next week. Make sure you listen to us. We're on iHeartRadio, iTunes, SoundCloud, and all of our podcasts are available on our website at youngmedicalspa.com.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes, so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittinen social media creation. Steve Mittinen, socialmedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.